Here's our audience and one on FaceTime. Okay.
So you think about the saying, you never know when it can happen to you. Meaning someone starts choking. What would you do? So you're out at dinner and you notice somebody frantically running around needing help. My family member's choking, my family member's choking. Would you be able to assist them, or would you run away and hide like a turtle in their shell? The Heimlich maneuver is a skill that may help you save someone's life. I personally have not had to do the Heimlich maneuver on anybody. However, I get very nervous because I have a little boy and we are starting to introduce foods for him, and I feel like one day I'm going to have to do it because, oh my gosh, if he gets a hold of something or he gets a piece of food that's too big and it gets stuck. After discussing the steps and a quick demonstration, I'm confident that after today you will know the basic steps regarding the positioning, anatomy, and the motion. At this time, let's go back to the basics. What is choking? Choking is when an object is blocked or is obstructing, or it's lodged, I should say, in the throat, causing it to block off the airway, so there's no oxygen moving. According to the Mayo Clinic, the signs and symptoms that you would be looking for would be the inability to talk, difficulty breathing, noisy breathing, squeaky sounds when trying to breathe. The cough is either weak or very forceful. You can notice that the skin, your lips, nails are turning blue or dusky. You might notice that the skin is flushed and then turns pale or bluish in color, or the loss of consciousness. But the universal sign is when somebody's hands are to their throat. Now, we see a person choking, or we see a person that needs help. What do? So first you're going to stand behind the person or the patient. You're going to wrap your arms around the waist, and you want to make sure that the proper positioning, that the person is slightly forward. You don't want them straight up and down, so slightly forward. And then I had always been taught that you want to make sure that your leg is kind of bent in front of one foot in front of the other for balance purposes. And then if the person would start to lose consciousness, you can slowly let them fall down. And so regarding the position, where do we put our hands? So you're going to first make a fist, and with one hand, and you're going to position it below the rib cage but above the navel. And you're going to want your thumb towards the person. And according to the Children's Hospital of King's Daughters, if the person is very large or pregnant, you're going to place your arms around the armpits or under the armpits. And if your hands are on the lower half of the breastbone, and you're going to pull straight back. So you're going to kind of above, but you're going to be right at the breastbone, bottom of the breastbone. If you're doing it to an infant that's less than 1, you're going to do chest thrusts. So you're going to have 2 fingers, and it's going to be between the nipple line and middle. So right in the middle here. More importantly, the action. What are we going to do? So you're going to grab the other hand, and you're going to go up and inward, right? So thrusting motion. When do you stop? You're going to give 6 to 10 good blows. And when the person starts coughing, talking, breathe, or if the person stops breathing, this is when you're going to initiate CPR. So stop the Heimlich maneuver. And in regards to the maneuver, I would like to briefly discuss the American Red Cross and their recommendations. They recommend a 5 for 5. So what is a 5 for 5? 5 back blows, 5 abdominal thrusts. So you're going to give 5 back blows. You're going to place your arm around the person's chest to help support them in the middle of the shoulder blades of the person's back. You're going to use the heel of your hand and give 5 blows to the back. And then you'll give the 5 abdominal thrusts. So 5 for 5. To summarize, In 2017, more than 5,000 people died from a choking event. Again, quickly, you're going to first wrap your arms around the person's waist, and you're going to place your arm in front, thumb in front, over, up, and in for a choking event. Up and in, right? And we can help lower the number of 5,000 at the end of the year by educating somebody like you to know what to do when someone's choking. So remember that a choke is no joke. Okay.
Very nice. 5 for 5.
Yeah.